We continue our in-depth look at the mental health of Minnesota's youth this morning with a look inside the new Inpatient Mental Health unit at Children's Minnesota.
Jamie Winter, Director of Inpatient Mental Health, recently walked us through the space.
We also wanted to be able to give kids some control and autonomy over their space, and so they have some options. So as you can see, lighting, they can change the color, they can dim the lights. They also are able to stream in content, so music, guided meditation, things like that.
So this unit opened up in November to meet the growing need for mental health care for people under 18.
And Jamie joins us live this morning with more on what inpatient care means and how to navigate the mental health system. Jamie, thank you so much for joining us.
Yeah, thank you for having me.
So let's start with this. How much of a demand have you seen when it comes to mental health?
Yeah, at Children's Minnesota over the last 2 years, we've seen about a 30% increase in the number of kids coming to our 2 emergency departments needing immediate care for a mental health crisis. This is something we've seen both nationally and at the state level, really increasing exponentially.
What do you attribute that to?
You know, I think it's been really challenging coming off of the COVID-19 pandemic where kids were more isolated, they switched to distance learning, they maybe didn't have access to the same resources in their schools or in their communities. We also saw a lot of kids and families deferring care during the COVID-19 pandemic, and so I think we're really starting to now notice those impacts exponentially.
I'm curious as a parent because this can be really tough to navigate, you know, trying to tell the difference between, you know, a teenager who may just be moody and realizing this may be something else. How do you tell the difference there?
Yeah, it's not easy. So the things that we look for are those notable changes in behavior. So in teens, that may mean that they are more isolative or they're withdrawing. They maybe stop participating in activities they once really enjoyed doing. We also may see kids not being willing to go to school or do activities that they once really enjoyed.
Jamie, when I saw this story, the first thing I thought was, well, I'm just grateful that we have a resource like this here in Minnesota. How rare is it to have these sort of new facilities out there?
Yeah, so we're very lucky here in the Twin Cities Metro that there are a number of hospitals that have inpatient mental health beds, but we still see the demand far outrise the really need for services. And so we're excited to be able to bring this offering to Children's Minnesota because our kids and families in our community need it. And we're really lucky to have a couple of options here in the Twin Cities Metro for care.
So we saw this story with Susan Elizabeth Littlefield, and you walked us through the hospital. Can you kind of explain what happens in an in-care facility?
Yeah, so on an inpatient mental health unit, it's really a 24/7 level of care. And so kids participate in programming and receive therapies throughout the day. At Children's Minnesota, we have a number of team members on our multidisciplinary team who help participate and facilitate that care, from our psychiatrist and psychologist to our program therapists. We also have a music therapist and an art therapist. And so really helping kids navigate through different programming, whether that be as a group, individually, or with their parents for family therapy.
Jamie, you just said it, that the demand far outreaches the supply here. So if a parent is watching and their child is struggling with mental health, what do you recommend to them? Should they get on wait lists? You know, should they reach out to Children's? Because that can be a very scary time. Oh,
it can be really scary. You know, I always really encourage parents to get services sooner than later. Really, that early intervention is key. There's a number of great places to start. So first, your child's school. So whether that be through a school social worker, guidance counselor, or their teacher, schools are a great place to get you connected with local community resources. The other place is your child's pediatrician or their primary care clinic. A lot of mental health care delivery happens within primary care, and so that's a great place to start when you're questioning whether your child may need additional services or whether they may need more intensive care.
What do you say, just listening to this, this can be overwhelming, right? You know, just, you know, having a child that may be going through a mental health crisis, there's a feeling of overwhelmment, right? What would you say to a parent who has to try to navigate this? Because this can be a real challenge, because parents deal with that trauma too, watching their child and realizing sometimes I can't necessarily help them the way that I want to.
Right.
Yeah. I think it's really important for parents to remember that they are not alone. It's not something that parents often maybe discuss with their peer groups or their friends, that their child is struggling with their mental health, and so it can feel like you're alone. And so I think it's really important to just remember that you're not alone, and that services are out there, and that there are many people in your community, in your child's school, that are able and willing to help. And so reaching out for help, asking for those additional resources at an early juncture is so important to help your child.
The other thing I was interested in watching this story, how long are these children generally in inpatient care, and what gets you to the point where you say, okay, I need inpatient care versus I can see a therapist outpatient?
Yeah, the one thing that really differentiates inpatient care is that safety, and so requiring the 24/7 level of care in order to keep your child safe. So we are often seeing kids who maybe have thought about or attempted suicide, or are really not able to remain safe at home, and so they access us often through the emergency department, and then come to the inpatient mental health unit. This is really a short-term crisis intervention service, so kids may be with us for less than a week. Sometimes they're with us a little bit longer, but a lot of the work that happens is really preparing kids to be successful outside of the hospital. The hospital is not a long-term solution for a child's mental health needs, and so it's really that immediate place for the crisis stabilization and to connect them with the services they need, whether that be day treatment or outpatient services once they leave the hospital.
And do their parents visit?
Absolutely.
Okay.
So that's one of the pieces that we feel really, I would say, grateful for at Children's Minnesota. We've really focused on bringing parents and family members in to that care. And so in all of our patient care rooms, we have the ability for a parent or guardian to stay overnight with their child, which was some of the feedback we heard from parents who helped us design this unit.
Crucial.
That if their child was receiving care at Children's for cancer or they had an accident, the parent would be allowed to be at the bedside, and that would be encouraged. And so we wanted to decrease some of that stigma around mental illness and look at how we created a similar experience for families going through a mental health crisis.
Have you seen that? You just brought up stigmatization, right? Have you seen that? Have we started to destigmatize mental illness and mental health a little bit?
Absolutely. I think this generation of teens has made such strides. They are more willing to talk about their mental health. They're more willing to acknowledge that they're receiving mental health care with their peers. I think that it's really becoming more normalized to have those conversations and to be really willing to say, I'm not doing okay, or I'm struggling right now and I need additional help. And I think that's really hopeful. I think it helps us as adults learn that it's okay for us to also reach out for help, or to have bad days where maybe we need additional resources or support.
This is what they mean when they say learning from our kids. We're learning from our kids how to have some of these conversations and letting us know, hey, it's okay to talk about this.
Yeah. All right, Jamie Winter with Children's Minnesota. Thanks so much for coming in today and doing a little debrief for us. We appreciate it. Now, if you know of someone who is struggling with their mental health, or if you are too, you can find help by calling or texting 988. That is the Suicide and Crisis Lifeline.
And for more information on this critically important topic, make sure you tune into CBS News Minnesota tonight, 6:30, special healthcare focus episode of Talking Points. That will be followed at 7 p.m. by a 90-minute ad-free presentation of Connecting the Dots. It's a documentary aimed at helping us understand the mental health struggles of many young people today.